Yeah, Andrew said, good morning. For a little while, it has been a little while. Neil Anderson.
Oh, yeah, no, I do have
It's 7:05. We want to be timely. I know everyone's giving up a free evening on a beautiful night. People are still pouring in, and the parking lot's full. So I just wanted to wait a minute or so, and I thought I'll talk and introduce our speaker. I just wanted to welcome everyone coming here tonight to learn about healthcare with Andy Slavitt. Can I just see a show of hands? I recognize faces. Who of you was here at the listening tour last night? That's so many. That's great with Steve Swedinsky. So I was going to say, if you can make it to tomorrow night, I'll give you one of these too. So anyone who participates in all three listening tours can have my pocket copy of the Constitution. So I wanted to just highlight that tomorrow night we're going to have another listening tour speaker, and that's Linus Chan. He's an attorney with the Center for the New American, and he's an expert in deportation. So he's going to really talk about how our legislators have let us down and partly created this crisis. And we're also going to be joined by one of our constituents from Eden Prairie, Assad, who'll be talking about how he became naturalized recently and what that process looks like. I think it's important that we all educate ourselves about immigration going forward. So welcome, and I'll introduce ourselves. This series of speakers, the listening tour, is brought to you by Indivisible CD3. And who we are a group of concerned constituents. We're residents of this congressional district who want to hold Trump accountable. We're concerned about the extreme Trump agenda, and we're interested in using our Congressman Eric Paulson as a lever to affect change. So I'm hoping that all of you are following us on Facebook or in our Facebook group. We have an email list. You can sign up for that when you came in, and be sure to join us for other events. One thing that we're going to be rolling out and working on now is our petition. Eric Paulson released Trump's taxes. As you may know, Mr. Paulson's on the House Ways and Means Committee, and he's already voted at least twice to not review and release Trump's taxes. So we want him to use the special authority that he has. And so we're having a petition that's online. You can sign paper copies. I'll be able to hand out paper copies of the petition for you to go around and talk to your neighbors about this issue. 74% of Americans want to see Trump's taxes and believe that he should release them. So it's a non-controversial issue and a great way to have a conversation with your neighbors, maybe who don't know about how Mr. Paulson votes. So we have a fact sheet up in the front and the petition, and we'll be collecting those later and delivering them in early May. So stay tuned on the email and website for that information. I also wanted to mention this great work behind me, the work of many people. I first saw this in February, and it's just been growing ever since. This is a collection of postcards with messages to Mr. Paulson, and you can actually fill out one for yourself in the lobby, and it'll be added. And come up and take a look at some of the messages. It's very moving. So I thought I'd mention, what is the listening tour? As you know, Mr. Paulson doesn't like to have public scheduled town halls. He prefers to have private meetings with businesses where people pay to hear him speak, or he shows up unannounced at a business. And he calls these visits a listening tour. And we thought that that's not really what I think is a listening tour. So we wanted to invite him to an actual listening tour in the district. And that's what inspired these three speakers. So last night we were joined by Minnesota State Senator Steve Swedinsky, where he talked about Civics 101. Tonight we'll be hearing from Andy Slavitt, our local healthcare expert, formerly with the Obama administration. And then tomorrow night, the speaker about immigration. So without further ado, then I'll have Andy Slavitt come up.
Thank you, Jenna. Thank you for all you're doing. This is a great a great thing for a very well-informed district that deserves to have these kinds of dialogues. So I'm Andy Slavitt, live in the Highlands neighborhood in Edina, my wife and our 2 boys, and worked here in Minnesota for the last 10, 12 years, and then spent the last 3 years commuting back and forth during the week to Washington, D.C. to serve in the Obama administration and oversaw the Medicare program, the Medicaid program, and the ACA. I got there really to help in 2013 when the technology kind of went like that. And I went in to help lead the turnaround effort, and I was honored enough that the president asked me to stay, and I had the time of my life. It was the most incredible experience. I loved it, but I'm back now, and I am still focused and dedicated to the same thing that I was back then. So I don't have all the answers, but what I thought I would do, if it makes sense, is talk a little bit about where we've come from, what the issues are on the table in healthcare, and then leave a lot of time for questions, for Q&A and dialogue, okay? So I'm gonna try to get through some opening comments that I think will be helpful, and then we can go into it. Okay, so what's happened over the last 7 years? So over the last 7 years, we've made incredible progress as a country after decades and decades where the healthcare system just didn't improve and didn't improve. And we made progress in a few key ways. First of all, the uninsured rate, the number of people without insurance, was cut in half. 20 million or more new people are covered for insurance, and that's a really big deal. We made a commitment as a country that we were going to offer people insurance no matter their income or their health status, and we've done it. It's an enormous change. And yes, it's hard. These things are hard. When you make changes like this, but we've gotten there, and that's what we should feel good about. The second thing that's happened is we've offered protections to the rest of the people in the country in some really important ways, and because of misfortunes happen, and in our country we don't believe that people who have these kinds of misfortunes ought to be stricken with them. We've said, you know what, if you get sick, if you are sick, if you've ever been sick, you're still entitled to have access to care. And we made it illegal. We made it illegal for insurance companies to not allow people to have access to care. We also made it illegal for all the little things those of us who remember back before 2009, remember the little gotchas, the caps, the things that said, oh, wait a minute, sorry, you've already spent the amount of money you're going to spend for the year, or you've only had X number of visits, sorry, we're not going to pay anymore. We essentially said, no, insurance is going to mean insurance. So half the people in America that were employed had lifetime caps on their policies. Those are also illegal. And the third thing that we've done is we have begun in the face of a very, very expensive healthcare system to make healthcare more affordable. We've done it in 2 ways. First is over the last 7 years, we've had the lowest level of growth in healthcare costs that we've ever had in this country. We're not bringing the costs down, but we're flattening out the costs. It's a first step, and it's a step and we've started to get a consciousness about what else needs to happen. It's very clear to us now that we've got to focus on how to make prescription drugs less expensive. A lot of need, a lot of interest there. The other thing is, for 75% of the people who buy a healthcare policy in the exchange, they pay $75 or less per month in premiums. And that's what people have said that they can afford. And even when premiums go up, for those people, for those 75% of the people, they still pay the same because they have a tax credit that goes up with the policy. So more affordability, more people covered, real progress, and even we've seen improvements in quality outcomes. 95% of quality outcomes in the country are improved. Okay, that's what the ACA did. What didn't the ACA do? Because the ACA wasn't perfect. So let me tell you 3 things the ACA didn't accomplish. First of all, the tax credits that the ACA provides, they stop at 4 times the poverty level. So people who are really in the middle class don't get access to those tax credits, and healthcare is very, very expensive. If you're employed, your employer gets a tax credit for giving you coverage. If you're Medicare and Medicaid, you get access to coverage. If you have less than 4 times the poverty level, you have access to coverage. But if you're buying coverage on your own and you're above 4 times the poverty level, really solidly in the middle class, you don't have access to that tax credit. That's something that I wish the ACA would have corrected, and it's something that we can really focus on now. Second thing the ACA didn't do is it didn't provide any teeth to keep insurers offering coverage. So this is, let's just be very clear, this is a center-right healthcare policy. This is not a left-wing healthcare policy. This is a center-right healthcare policy that was developed in a right-wing think tank, that was first rolled out in 2 states with Republican governors. Remember Romneycare in Massachusetts and in Utah. And President Obama and the team got there not because this was their first choice, but because they were aiming to forge a consensus, this sort of imperfect American consensus. Now, obviously, they ran into a very belligerent opposition, but to be clear, that is a difficulty, that is a flaw, that is a challenge. That means there's no public option. There's none of the kinds of protections that I think some of us would have liked to have. And the third flaw in the ACA is that it didn't prevent the Republican Congress from robbing it of its funds. And that is something that no one could have anticipated. When other social legislation is passed, Social Security, Medicare, Medicaid, Medicare Part D, the prescription drug program, everybody, they were long, bloody battles. I've studied them. But at the end, everybody got together and passed the kinds of things that made it better. What nobody anticipated was that Senator Rubio and others would instead not only not support the law, but rob the funding from the law. And so far to date, $10 billion of funding that was designed to keep rates low and keep competitors in the market was robbed from the program, and more than a dozen insurers actually went out of business as a result of this. So those are 3 things that I think happened over the course of the time that made it certainly not what it could be and what would it be today. Okay, so we had an election, and coming out of the election, we sat here with the ACA, and a bunch of folks ran on, let's repeal and replace this law. And I want to come back to this question of, what did people hear when they heard people say, we're going to repeal and replace this law? On the other hand, my perspective, and I think the perspective of President Obama at the time, was, look, there should be no pride of authorship. If people want to improve healthcare, better late than never. If you have ideas that are going to make healthcare better, they just need to accomplish 3 things. And I think here's the 3 things. Number 1, cover more people. Number 2, do it more affordably. And number 3, do it with better coverage. So if anybody has ideas, and if anybody had ideas that were going to take healthcare and cover more people, do it more affordably, and do it with better coverage, I don't care if it's a Democrat or a Republican. We all have a rooting interest in the best ideas. Of course, hopeful that would happen, we soon saw what was inside the Ryan plan, or now I would say more aptly Trump Care, since he adopted it. So let's look at those 3 tests. Does the new bill that was proposed cover more people? No, and in fact, we now know that somewhere in the neighborhood of 24 million people would lose coverage, because it would be, and the reason, it's not actually what Representative Paulson says, which is that it's because the mandate goes away. That only affects a couple million people. The reason is it would largely be unaffordable. In this district alone, in our district alone, over 50,000 people would lose coverage. Second, does it make it more affordable? No. In fact, the CBO estimates, and this is a The CBO, for those of you who don't know it, is a nonpartisan organization run by a Republican, reports to the Congress. It says premiums will go up 15 to 20% under the new bill, unless you're older and unless you're sicker, in which case they'll go up much more. And in fact, people that are between 55 and 65 could see premiums go up over 700%, in many cases to more than their actual income. So this is the math that's in the bill. Okay, no wonder Ryan wanted to rush the process without a public hearing and without any time for analysis. Third, did it make coverage better? Well, towards the very end, the Republican put on an amendment which would actually allow states to take the pre-existing protection coverage away. So now we have a bill that didn't meet, at least in my mind, any of those three hurdles. Those are the three hurdles that I think were important. So I think it's a terrible piece of legislation. Not because it was written by the Republicans, but because it's bad for people. And I think as a result, not surprising, it didn't get a lot of support. So let's talk about a little bit about how people have reacted to this. But let me just, before I do that, fill in a couple of other thoughts on what this bill is. They talk about this as a health care bill, and it's really not. What it really is a tax bill. And it's a tax bill by design and by the design of Speaker Ryan. What the bill does in the mainstay is it makes some changes to the exchanges, which are negative in the way that I described. But the bigger thing that it does is it takes $1.2 trillion that's spent on health care for the middle class, for lower income people, and for seniors, and it eliminates that spending and passes most of it back in a tax cut. And the tax cut goes to insurance companies, pharmaceutical companies, like medical device companies, CEOs of insurance companies, people with incomes of over $500,000, and tanning salons. It's a true story. That's true. It's true. Giant tax cut, and I got the privilege, because I paid $35 to hear Representative Paulson this morning say that he really wants to get rid of those taxes. And yes, he acknowledges that they benefit the wealthy, but he says that's good for the economy. I wish he was here to say it to us, but he did say it this morning. So it is where it's most destructive, and where I have the biggest concern with it, is it takes a 25% cut out of the Medicaid program. Now, the Medicaid program, for those of you who don't know, half the children in our country are paid for by the Medicaid program. Half of the long-term care in our country is paid for by the Medicaid program. Medicaid cover a third of all opioid treatments are paid for via Medicaid. If Medicaid were cut by 25% in Minnesota and in many other states, it would just be an absolute disaster. So it effectively takes a 50-year-old social safety net and upends it. And to be fair to him, Paul Ryan's not bashful about it. Everything that I've just said, I think he would say quite proudly. This has been his goal for quite some time, to get the federal government away from providing these entitlement programs that he believes the federal government shouldn't be doing. And then he puts a cap on it. So not only does he cut it by 25%, but then he caps it so that the Medicaid won't grow again to be something that costs the federal government more. So it hurts Medicaid, and what it also does is it is very destructive to Medicare. The ACA added 10 years to the life of the Medicare Trust Fund, up to 2028. This bill would reduce the life of the Medicare Trust Fund by 4 years to 2024. So you ask yourself, okay, now I'm a little confused, because Paul Ryan is a fiscal conservative who talks all the time about worrying about Medicare and worrying about Medicaid. Why would he want to hurt Medicare that way? And I'll tell you what I think the answer is. The answer is, if he throws Medicare into crisis, it gives him the opportunity to come and say, we've got a program in crisis and we've got to cut the benefits. And that's his real design. His real design is to turn the Medicare program into a voucher program, where instead of a Medicare card, you get a voucher to buy insurance through a private insurance company. That's what he wants. That's the agenda. And so all of the noise about the exchanges and about how they're exploding and imploding and all those other things, that's the shiny object. That's a very small part of this bill. This bill really is about the $1.2 trillion that's cut from our social safety net. So that's the most important thing I think we should all try to remember. Okay, so what are Americans saying about this? So I'll tell you, it was November 9th, November 10th. I started getting on the phone with state governors, with hospital CEOs, and they all were saying the same thing. We lost. The ACA is going to be repealed. It's over. Time to just get on the Trump train. And I will say that I felt at that moment that if we educate ourselves, we educate the public, if we get the facts out, the Republicans who are proposing this repeal are going to have a difficult time. Because I believed, and I still believe, that when people heard repeal and replace, they heard, oh, you're going to make it better. They didn't expect to see something that would increase premiums by 20%, and by the way, increase deductibles by 40%. So when you run on decreasing deductibles, then you throw out a plan which increases deductibles, the question is, well, would people pay attention? And people paid attention. 75% of Americans want Trump to just fix it. Just fix the parts that don't work. The ACA is at an all-time high in terms of popularity. 55% of Americans now believe it. Nobody thinks it's perfect. Nobody's ever said it was perfect. But we in America want to make incremental progress. And so the message is being delivered, I think, pretty loudly and clearly that we just want to keep making progress. We just want to keep covering more people, and we don't want to lose what we've started. Okay, so you're going to hear practical ideas and ideas coming from all over the place, because I think right now the Republicans who are sponsoring this bill understand that it's not working, it's not popular. I'm happy to answer questions about ideas you're hearing, about things that maybe people are proposing. Some of them are tricky, some of them sound good, some might not be. There's some things that are, I think, good ideas, like increasing subsidies, like public options. Reinsurance is a good idea because it allows people to get covered less expensively and treats them equally. More investment in Medicaid, I think those are all good ideas. Where I start to worry, where you should start to be a little suspicious, is when you start to hear the buzzwords. If you hear the word freedom, watch your wallet. Patient choice, freedom, what that means is they want to strip down the benefits. They want to start allowing people to offer benefits that cover a lot less. High-risk pools, you should be worried about those. Those are suspicious. Those are basically saying, I want to quarantine people who are sick and give them different coverage than everybody else. Why? So that people who are young and people that are healthy can get cheaper health care. The problem is, everybody eventually gets sick, and the one truism is, we never like to think about our health until it's the only thing we think about. And a program which says we're going to find a way to give something to people that's cheap and valueless, but doesn't actually reduce the cost of care, just makes the cost of care more expensive for everybody else. So what to watch for? What to watch for next? I'll point you in three directions. Okay, let's start with the Congress. Congress has a reconciliation authority for 2017 that's open, and they want to keep it open. And I heard this morning that Leader McCarthy really believes that his best shot to get this will be to get this back into the House in May. And so I would tell you that they're almost blindly focused on getting this passed. What do I mean by that? They know that in order to get something through the House, they have to put something that probably wouldn't legally be able to even be voted on in the Senate, and they don't care. They feel like if they don't deliver on this, they failed, whether it's because they failed to deliver on the promise, or whether they feel like they're losers or what, I don't know, but I recommend counseling instead of this nonsense. So you're going to see them continue to use that process. There are other tricks that they may use during the course of the year. There's something, people know what the Children's Health Insurance Program, or CHIP, is. CHIP is up to be reauthorized this summer, 1st of September. This is going to be one of the big questions. CHIP is very bipartisan. It's always been bipartisan, and the way we know it's bipartisan is people always pass what's called a clean CHIP reauthorization. That means is people don't load it down with things that one side or the other hates in order to hold a gun to their head. So a lot of talk in the Republican caucus about loading up CHIP with some things like we've talked about, high-risk pools and other kinds of things. We have to advocate strongly to our representative for a clean CHIP reauthorization. Very, very important, because it's one of the ways that they can do this. And I will tell you that the Democrats are in no mood to play chicken with children's health insurance. They're going to let the Republicans run right into a wall if they choose to do that, and I think that message has to be loud and clear. So that's the first place to watch, is what goes on in the Congress. Second is the administration. What's the Trump administration going to do? What do they have the power to do? So for the last period of time, yeah, it's funny, isn't it? Yeah. Okay, maybe they're making it up as they go along. But I think they've got a decision to make here. The way they've been behaving to date has been, in effect, to continue the sabotage of the law. And what do I mean by that? By essentially saying we're not going to enforce the provisions, particularly the provisions that keep younger people in the market. That jacks up the rates. Their payments that they have that are owed to insurance companies, they haven't committed to making those payments. If they don't make those decisions by April 30th, they will be responsible for increasing premiums by between 20 and 30% just by their own inaction. Why are they doing this? Trump believes that somehow playing chicken with our lives is going to force the Democrats to the table. And I think if you look at all the polling, first of all, my advice is if you're going to do that, don't say it out loud, because people don't like that. The polling has shown that people see right through it and they don't want to let it happen. The third place to focus is here in the states. And the less successful they are in Congress, the more they're going to try to do stuff through executive action at the presidential level or here in the states. Fortunately, I think we have, as much as we have a governor and a legislature that are far apart, they work together on a tough compromise to get reinsurance done. I think it was the right thing to do. I think it was helpful. I know we didn't get everything that everybody wanted, but so long as we have people who are willing to work together and care about the right issues, I think we're good there. I would say we have a gubernatorial election coming up, and we ought to just be very careful, and we ought to make sure we have the people in office who are going to continue to do that, because more and more of this is going to move towards the states. Okay, final point, and then we'll go to questions. Recommendations, actions, what can we do? First thing is this, and this has really helped me. Remember this. Our president is not our country. We are our country. Our politicians are not our country. And you know what? They never have been. And that means that all of the people who are not happy with what they're seeing, taking a stand, getting informed, getting out there, getting educated, and understanding we're not powerless. And I think that's critical. I know you all probably don't feel that way, but you may have friends, colleagues, or otherwise that are feeling disheartened, and I think it's really important just to understand that. Second is to understand that there are things that can be done and that make a difference. Every day when I worked in the Obama administration, the first thing I did when I got up in the morning was I read emails from Medicare beneficiaries, from Medicaid beneficiaries, from constituents, from people who wrote me letters. Write public officials, both at the federal level and at the state level, letters, and write them call them, call the offices, insist on town halls, be very vocal, be very visible. It works. And one of the reasons I know it works is I was a week or two ago walking around the Capitol, and I ran into a Republican representative who told me very specifically, hey, all these town halls, they're not making any difference. I said, I don't remember asking you. The third thing is this. The third thing is this. Our representative is in a difficult position. And here's why. Who here has a boss? Who has a boss? Eric has a boss. His boss's name is Speaker Paul Ryan. Is it easy to disagree with your boss? It's hard. Your boss wants you to do something. You want to be a team player. You generally want to say yes. So Eric has a boss that wants him to vote yes. Now, we all also have other things in our life besides a boss, whether it's our conscience, whether it's our morals, whether it's our church, our temple, our family, our belief system. And in this case, Eric has something else besides his boss. He's got his real bosses. He's got you. And so the real question Eric has to deal with right now is what happens when one boss says one thing and his real bosses say another. What is he going to do? And I was making phone calls to, there are congressmen that you could put into the category of they're in districts where there's a lot of both Democratic and Republican support. They may have voted for Secretary Clinton in the presidential race, but still elected a Republican congressman. All those people are in a very special category, and they know it because they've got to toe a line. They've got to at least make noises like they're listening. Well, here's the point. He's got a choice to make. So far, he's chosen his Speaker Ryan as his boss. He's not chosen you. He's not chosen me. He's not chosen us. And he's going to have to make that choice. And as he makes that choice, you're going to need to decide whether or not he deserves to be reelected. That's all. And he needs to know that that choice has that very real consequence for him. Because I will tell you, you're his boss. You can hire him. You can damn well fire him too. So if he doesn't feel that, he will not be able to stand up to his other boss. There is no other way he will do that. So with that, I think we have time, plenty of time, for people to ask questions.
Would you comment on Medicare for all?
Sure. So the question, I don't think I need to repeat it because you've got a great booming voice, but the question is, what about Medicare for all? And I think I was in the White House in the Roosevelt Room one day with President Obama, and I've not been to the Roosevelt Room with President Trump. And sitting around the table, we invited in a bunch of insurance companies, and they proceeded to tell us, here's my demand A, here's my demand B, here's my demand C, here's my demand D. And by the way, I say a little bit tongue-in-cheek, some of the things they were talking about were more reasonable things, but you sort of realize you're in a position where a bunch of people from the private sector coming in and telling the president, this is how I want it to be. And the president was a good listener, and he turned back and said, you know that poll which shows that the ACA is at 45% popularity, now by the way it's at 55%? Because you know one of the reasons why it's at 45% popularity? Because there's a huge slug of the population that thinks y'all are crooks and that we ought to have single payer. So be careful. Be very careful. I thought it was a good moment. So, we have a Republican legislature, we have a Republican House, a Republican Senate, Republican President. We're not going to have single payer in the next number of years. We're just not. But what's happening is every time people are having the discussion, seeing what it's like to lose coverage, and the insurance companies are putting people in the position of putting people, it makes the question go that much deeper. Now, it may not end up as Medicare. It may end up as Medicaid. We have something in Minnesota called Minnesota Care. That is not Medicare per se, but it is a single payer mechanism for people in modest incomes, and it's highly effective. It really works. So there's a lot of ways to get there. I suspect, given, unless there's a really dramatic change in the composition of the Congress and the White House, that as it happens, it will begin to happen at the state level. Well, there was a shot at it just about a month ago here, a few weeks ago here in Minnesota. Didn't pass. With a different legislature, maybe it would have. But if that's where people are, I sense people paying a lot more attention to the public mood on that issue than ever before.
Andy, I have a question for you. As it pertains to the whole United States, you know, the Republican Party, ultimately what they'd like to do is they'd like to decentralize healthcare. They'd like to push it back on the states. So in their dreams, they have Medicaid going back to the states. Explain what the difference is for the impact on California versus, let's say, Alabama, in having a place that has a smaller tax base in terms of moving Medicaid back to the states and what that means.
Yeah, I mean, it's a great question, and it's a little bit complicated, and I know that you are a healthcare guru person who gets it all, but I'll try to simplify it. You know, what they would like to do is they would like to just say, I'm going to give each state a fixed amount of money, and that's as much money as you're going to get for Medicaid coverage. And that means that if you have people with disabilities who need treatment, if you have aging population, if you have more expensive care, if your care grows more, if you have the Zika virus, if you have anything you don't anticipate, either the state's going to pay for it, or more likely what will happen, because states are not much into raising revenues these days, is they will tighten the eligibility rules. And they'll say, you don't really qualify for coverage anymore, or make things much more difficult in terms of qualifying for coverage. A state like Minnesota, which is more efficient, would be even more disadvantaged in a situation like that, because there would be some mechanism of moving towards the mean. So this whole idea of a block grant, or there's another term people use called a per capita cap, which is very similar to a block grant, is a very, very dangerous way to change the Medicaid program. Now they will say, but wait a minute, we ought to let states innovate. Here's my answer. Absolutely. States can innovate right now. Indiana, under then Governor Pence, did a very Republican-oriented waiver that I approved, even though I didn't agree with it, because it was innovation that they wanted to do there. Now, I approved it, but I made some restrictions to it. And the restrictions that I made are now ones that will not be made, sadly, going forward. But an ideal Republican Medicaid plan has the following. Anybody who gets a benefit must be drug tested. Anybody who gets a benefit must be working, and anybody who gets a benefit must be paying premiums, have skin in the game. That's a Republican ideal of Medicaid. That is a complete lack of understanding of how people live, in my opinion, and feel free to disagree with me, but I have to state my opinion.
Speaking of skin in the game, why can't we get traction on having government employees in the same pool with the rest of us?
Couldn't hear.
Question is, why don't we have government employees in the same pool, in the same risk pool as the rest of us? It's a good question. I don't know the answer to why that is, but I think everything that makes our politicians feel the same thing the rest of us feel is going to be helpful.
I want to come out and say, I don't think we're discussing really the right problems and the right questions.
Okay.
And I think it's really important, and I think it's what's being missed by the population, the politicians, the pundits, and everybody else. And that's the actual cost of healthcare. And we're not talking about health, and we're not talking about healthcare. We are talking strictly about healthcare financing. And it's a problem, because until we have these other conversations, all the healthcare financing, cost shifting, shell game, whether it's Democratic, Republican, is insurance driven, whoever, it is not gonna solve the problem. And I really have a
It's a great comment. Thank you. And let me just speak to it a little bit, because it's exactly right. And there's been a debate in health reform about whether or not you can cover more people and reduce costs at the same time, or whether or not you have to do them in some sort of sequence. Massachusetts, which now, a dozen or so years ago, was the first one to roll out something like these exchanges, did them in sequence. They covered people first. What that does is gets everybody in, it reduces bad debt. So nationwide, there's about $1.1 trillion of money that wasn't getting paid to hospitals, so it was getting paid out of our taxpayers' pockets. That's reduced now, and it's money for savings. And so we are managing costs more directly. But if we don't take on, and I'm sorry, I don't know your name, but if we don't take on the questions that you raised, then we're going to have serious issues. So why is insurance expensive? Let's talk about why insurance is expensive. Did you ever look at a bill after spending 3 days in the hospital? Did you ever look at what your prescription costs if you had to pay it out of pocket? So if $20,000, if it costs you $20,000 to spend 3 days in the hospital, until you fix that problem, all we're going to be doing is subsidizing and providing tax credits and so forth. But it's an enormous problem. It's a challenging problem, and and there are a lot of entrenched interests. So I don't think we can wait to cover people and get care they need until we solve that problem. But I also don't think we can ignore that problem, because this is an all-encompassing cost structure. We have to do something about the cost of prescription drugs. And I'll tell you, take a look at our congressmen and all the other congressmen, and just look at who the biggest lobbyists are that support their campaigns. It's very, very difficult.
But I'm just gonna make a comment
Go
that
ahead.
by forming legislation and things like the ACA, you're just making it that much more entrenched by not addressing the real issues. So now you just add another layer on top of the onion of mess that we're in. So, and then try to entrench that, and you're not gonna be able to. You just keep digging it deeper and deeper and deeper hole.
So it's complicated. I don't.
So,
I'm
go
just
I'm
no.
very passionate about it.
It's fine.
Just
It's a valid opinion. I don't agree with it, but it's valid.
And I think I think you're ignoring the fact there are some efforts, even within ACA, to make those changes in cost. Preventative care is a big one. You know, it's an area I've worked in for a long, long time. And until that was included as a basic coverage, right, which it costs a lot more when you're sick than it does to prevent something from becoming sickness. So those are elements that were part of what we're trying to do. And yes, it's predominantly a financing issue, I get that, but it has to be looked at as a whole.
There's a reason that since the ACA, we've had the lowest medical cost growth in the history of our country. And a lot of it is because we are starting to give people regular access to physicians, so they don't come into the ERs quite as much. Some of it is because there are investments in quality and getting paid for quality, but it is a long journey. And I spent probably half of my time at CMS not focused on coverage, but focused on quality and cost issues. And there's a lot of entrenched changes that need to be made with physicians and hospitals and so forth. So it's a great issue. Don't disagree with it. But I think if you told people who don't have access to care that they can't get access to care until we solve that problem, I think they would probably disagree.
To the same point, didn't Al Franken introduce a bill having to do with prescription drug costs?
He did.
And it's a very comprehensive
did.
bill.
He
So
did.
what's going to happen with that?
Thank you. Thank you for pointing that out. The point made, if people didn't hear, Senator Franken, with some of his co-sponsors, put forward a bill, a really comprehensive, I think quite thoughtful bill on addressing the cost of prescription drugs. And it dealt with a number of different things. It dealt with things we've seen before, like reimportations. It dealt with allowing the federal government to negotiate for the cost of prescription drugs, which I think is a good idea. It dealt with how to get more competition by getting more generic competition through the pipeline. It dealt with things where companies can essentially buy more patent protection, which is essentially how they keep costs up longer. I would love to tell you that I think that going to have an easy road. Here's what I'll tell you. Here's a place where I think President the current President Trump has a focus on this issue. So I think he's been talking about these issues. I think what he's learning is anytime you try to take on cost, you get a brushback pitch from the lobbyists. And I think he's learning Washington, and sadly, it doesn't make me as optimistic about the ability to get that done. The pharma lobby is very strong, and it takes a lot of what he himself would call stamina to get that done. This is an issue though, that you can get actually something done in a bipartisan way if there's enough courage. If the president reaches out to people like Senator Franken, they could see eye to eye on an issue like this. It's one that's enormously popular with the American public because all of us feel it, and all of us live in fear of losing access to our chronic care medications. And the price increases, EpiPens, everything else, are just dramatic, and it's across the board. So it's a very concrete area. It's an area where I think progress can be made, but it's a tough, tough area because of the entrenched issue,
So that's,
interests.
I think it's Senate File 771. And, how about if we get behind it?
All right,
We should.
good. We go to the gentleman in the back.
Yeah, could you explain what you did in Massachusetts? I've heard that that's supposed to be a very good plan of work for people in that state. Why can't we do that in Minnesota? And what's the difference between that Massachusetts plan and the Affordable Care Act?
So virtually the same. Question is about Massachusetts and what's the difference between Massachusetts and the ACA, Romney Care and Obamacare. Very, very similar. The differences you have are every region of the country, every state has a slightly different set of dynamics. In the case of Minnesota, the dynamic we have is we had this MNsure pool, which made the number of people in the exchange in Minnesota very, very small. And because they were very, very small, tended to be the sicker population. So things needed to be done to improve the risk pool. I think the work that was done by the legislature and by the governor will help. I think there are other kinds of things that will help. But to me, this is kind of someone just did an analysis, which I can point people to. I can post a link up on my Twitter feed. Someone did an analysis which showed that of the states, 25 state exchanges have healthy levels of competition and healthy levels of price, like Massachusetts. 4 are really in a struggling mode, and the balance are in a mode where there's some things that are good, but they need some shoring up, kind of like the reinsurance pool.
What prevents the healthcare consumers, us, being able to call doctor's office and shop around for prices? What, because that would help drive the cost of healthcare down, so why can't we do that?
Well, so the question is, why can't we get better transparency into prices?
Yes.
And sadly, this is an area where you would think we'd be able to make faster progress because these things should be knowable. And indeed, depending on the insurance plan you might have, there are some plans that have the ability to do this. But part of the contracting process keeps those things secretive. And because the way that works is an insurance company trying to get a lower rate from a hospital, the hospital may say, I'll give you a lower rate, but I don't want you to tell the other insurance companies because I don't have to lower their rate too. So we have this very perverse system. Goes back to your question about why don't we have a simple single payer system. But that's the way the economics have tended to work, and it's why it makes things much more complex. There's a pretty good movement for things that are more consumable, where if we knew the price and we knew the quality, they would help us more, things like MRIs and things like dental care and so forth. And some of those things are becoming a little bit easier to grasp, but it's still a far cry from what would be most helpful to us.
But that takes
Hang on.
all the rights away from the consumer.
What does?
That whole contract and pricing thing. Consumer has no rights at all in there. person that needs the health care. And then now I've got a government telling me, gotta have it, so you get to make the insurance companies wealthy, and you don't get squat for
It's
it.
even worse than that.
Well, I know it.
It's even worse than that. It's even worse than that. It's even worse than that because you can, what happens is they can set a contracted rate, and then if someone goes to take care of you that's not part of that, they can balance bill you for the difference.
No, I know.
So, no, the consumer absolutely loses. Consumer absolutely loses
And I
in this
heard
situation.
Tom Price talking about balance billing too.
Tom Price sponsored a bill to support balance billing for Medicare.
Uh-huh.
So, there's an important question, and I think you're honing in on it, which is, look, what's the true north there? Is your true north the doctor and the money they make? Is it true north the economics? Or is your true north the patient and the quality of care of that patient? You can tell pretty quickly in these conversations when you're talking to people whether or not what they value and why and how. And I think that's why when people use the terms like freedom and choice and so forth, they don't really mean it. What they mean is they want people to have the ability to change it up on you. Let me go to someone else.
You were the acting administrator of the Center for Medicare and Medicaid Services for 2.5 years, despite the fact that your company in Gen X was accused of disenfranchising countless millions of Americans in the largest healthcare-related settlement in American history. How are you qualified to talk about healthcare?
Okay, almost right, but not quite. I think you're talking about a case that happened in 2000. I joined in 2005 and cleaned up the case and got it settled. But if you want to talk more about it, let's have at it afterwards. Anytime.
Andy, thank you for coming. Really appreciate you.
Sure.
Accountable care in the ACA versus the new kind of failed repeal, replace, and what you see about accountable care moving forward, and what we can do as consumers to push forward on that, particularly to providers or insurance where we have some touch point as a client or customer.
Great. Do people know what he means when he says accountable care?
No, that's what I was asking.
Okay, great. So, no, it's great. It's a great question. There was something inside the ACA, and it goes to the points being made around cost, which is that the way we pay for care today, if people know you go to a hospital, you get an itemized bill, every single thing you do has a fee for it. That's generally referred to as fee for service. So if you have to have a little bit of surgery and you have a anesthesiologist, well, you get charged the anesthesiology fee, you get charged for the surgeon, you get charged for the surgical room, you get charged for the prep time, you get charged for all these things, you get a long bill. What accountable care basically says is, rather than look at all the inputs, we're going to do our best to try to look at the output. We're going to try to answer the question, was this done efficiently? And was it done effectively? Did we get to a better outcome? So if we did the surgery, you got released from the hospital, and you had to go back within 30 days because something was done wrong, well, we're not going to pay the hospital twice. But if you got a good outcome, and it's very hard to define good, but just in this context, defined by the standards that physician practices define, then we're going to pay even more. So it's a concept, accountable care, of saying we're going to make the people delivering care accountable for the quality, and we're going to pay for what works, and we're going to pay less what doesn't work. Great idea, complicated to administer, but one that has, I think, been making, I think, in various parts of the country, very significant amount of headway. And over time, it's what's going to get some of the excess costs out of healthcare, and it's what's going to get people focused on quality. And if doctors can feel like they're going to get paid more when people are healthier and happier, that's going to be a good thing. So that's a concept that I think was in the ACA. We've been at it about 5 or 6 years. It actually wasn't touched in the Republican bill, so they left it as is to continue to move forward.
I just have 2 comments and then a question.
Sure.
So I was at Eric Paulson's office at 5:40 today for an appointment. And thank you for being my audience based on the last thing I told Eric when I left, which speaks to, does he report to Paul Ryan or does he report to his constituents? I said,
say this, you're never gonna agree with your representative on everything. That's not, but what's important is that you get an audience, you get to speak with them, and you get feedback, and they get to hear what you have to say. And I think what I would be more encouraged by is if he were here today, and if he were not requiring you to pay $35 to hear him speak, or get an individual appointment. And again, this is a really intelligent, thoughtful group. These are great questions. They're challenging questions. There aren't perfect answers. And sometimes he may see things that you don't like, and sometimes he may see things that you like. But the point is to be able to have that dialogue so you can make an intelligent decision. And yes, I do think making him understand, making all of our representatives understand what their district thinks, what their district needs, and what they feel are going to help them make better decisions.
Can I just say, I also, I get a prescription from CanadaDrugs.com. I cannot use my insurance, but I pay 1/8 what I would pay at a traditional pharmacy. And then my question for you is, I have a friend who runs a nephrology clinic in the Twin Cities, and it's his opinion that the most fiscally conservative payment plan is single payer. And your opinion on that?
Yeah, I think there's no perfect system, and every system has its problems. No one would like a single payer system that didn't pay physicians or hospitals enough, and not enough people went into medicine, and we had long waiting lists and all of that. But those are all things that I think we can manage at each side. The best example I can give us is Medicare. We have 2 Medicare programs for those of you who are on Medicare. There's the traditional Medicare program, and then there's something called Medicare Advantage, which is provided by the private sector. They sit alongside one another. You can make a choice if you want to be in traditional Medicare, if you want to be in Medicare Advantage. There's advantages and there's disadvantages. And Medicare is a very efficient program. The Medicare 50-year-old program is an 88% satisfaction rate. People really are pleased by the program and what it does for them. So I don't think we should be lulled into being polarized by some of these concepts, and feeling like these concepts are so political. They're pragmatic ways at this, no matter which place you start. But at the end of the day, if you're not delivering for the patient, if we're not getting good outcomes for people, efficient outcomes for people, then we know we got to go a different direction.
I can't guarantee any of these numbers are right, but let's take it as sort of somewhat hypothetical. Insurance companies add nothing to medical care. I mean, they add nothing to my going to see a doctor and coming home either better or worse or the same. I've heard, and this is the number I'm not so sure about, but up to 30% of the cost of running clinics and hospitals is dealing with the myriad of forms and different healthcare companies and the different government programs, all of whom have a different way of getting paid and...
That sounds about right.
Yeah. Okay, so now we're talking maybe as much as 50% of the cost of what we're paying has nothing to do with doctors and care. Why can't we just recognize that that is a wasteful system, and we could cut our healthcare costs virtually in half by going to a Medicare type program for everybody? To me, it's so obvious as to be ludicrous.
Yeah. So look, I think that's the right dialogue, and not everybody in this room even agrees, but the fact that people can more clearly see the flaws of the current system, the inefficiencies of the current system, the people that get left behind in the current system are really, really important. Now, I'm sure there are people that could argue with all of the things that they wouldn't like about a single payer system, but I think our country's getting closer and closer to having that debate. And again, for people who are feeling that way, I think recognizing that we do have programs, again, like Minnesota Cares, like Medicare, many other types of programs where, look, in my experience, our country tends to not take enormous leaps. We tend to take steps. So I don't see us jumping to something that is radically different from where we are today. But what I do see is a state or a program trying it, it works, it spreads to another state, and that sort of thing. And that's where, if that's something you believe in, that's where I think I would be thinking about putting your energy. A woman all the way in the back. all linked. Or as someone else has said, healthcare is complicated. But it's true. If you are inside an organization, a great one like Children's, a small physician practice, you realize all the interdependencies that are there, and you also realize, as I think this gentleman said, we've done a horrible job mucking it up with things that have nothing to do with patient care as well. And I think there's enormous opportunity if we actually get back to focusing on the simple things: the physician, the relationship with the patient, giving them more time with the patient, taking a lot of the extraneous stuff away that doesn't add value to our care.
Andy, thanks for coming out.
Sure.
It's my understanding that here in America we pay roughly twice as much as any other country, and our outcomes are out of the 20 modern countries.
Yeah, right.
We're like 18 or 20. I mean, so we're paying twice as much, and our outcomes are almost last. And one thing I find challenging is that I keep telling myself, well, this is America, right? We should do better, and we should be able to, think we can do better than the rest of the planet. And so there are dynamics that are preventing us from doing that, whether it's those that benefit from the status quo, don't want it to change. But so the question I was going to get to before I get off the soapbox is, are there other international models that you see as somewhat attractive or applicable to maybe a direction that we should look at?
So I'll repeat in case everybody didn't hear. Essentially, we pay a lot more, and our health outcomes are not top tier. We're running. We can't even get a bronze medal. We're running distant. And I'll add something further to that, which is the best care we deliver in America is the best care that gets delivered in the world. The real problem we have is the inequity. It's the inequity. And I'll tell you, I've had a great opportunity to visit hospitals and clinics and nursing homes all around the country during my time in government. And I visited one place that completely inspired me. It's called Ascension Health System in St. Louis. It's a big hospital system. It's a Catholic system. And their commitment is not to improving quality of care, but it's to eliminating the inequality of care at of course the highest level of quality possible. And that's their mantra, and that's what they get motivated by, and that's their incentive. Because one of the reasons why we deliver such poor care in this country doesn't always have to do with health care. It has to do with the fact that many of us live in circumstances where it's very hard. It's harder to be healthy. You have to take multiple buses to get where you're going. There aren't pharmacies, there aren't healthy food, there's not safe housing. There's a lot of factors that are outside the healthcare system that we don't spend enough energy focusing on. People call those social determinants of health. And some of us believe, I believe, that we can do everything possible within the healthcare system. We can design the perfect insurance model, we can design the perfect payment model, we can have the perfect quality metrics. But what all the healthcare system does is it catches the problems. So if you don't go upstream and really deal with the issues that cause bad health, the issues that make it hard for people to get access just to the good health care that some of us are blessed with being able to get to, we're always going to be lagging. And so when I look at other countries and when I visited other countries, frankly, they're more homogeneous. So it's easier for them at some level, but they don't have the inequality that we have. We have a higher degree of inequality. I believe that contributes to the problem. Again, my opinion, you disagree with me, but I think until we get at that, we don't get at it. And Martin Luther King had I'm going to paraphrase it, but he had a quote, which the greatest form of inequality is health inequality. And that's I think where that comes from. Sir?
I appreciate your explanations of healthcare, and this is more statement than question. I wish the rest of the Democratic Party had done as excellent what it is, because when you hear numbers that 56% don't like, want it, repealed, a big portion of that 56% want it to be single payer. And so the media is not giving a fair assessment. So I guess, what do you do to get the rest of the elected Dems, and not just from the White House? I think the White House carried the water, Obama administration, as much as they could, but it seemed like the rest of the gang was just not present.
Yeah, I'll be honest, I think that was a failure on our part. I'm a part of the team, and I believe you're on the team, you own the failure fully. I think we didn't help people understand the impact of the ACA on people's lives as much as we should have.
This was easy to understand.
Well, thank you. And you know what, we're in the mood to listen now because it's under threat, and that's part of it. So I think some of it is you kind of think about what you have when it's at risk, and so I think there's more of a dialogue. But look, the closing of the donut hole for seniors in Medicare, massively popular. People don't realize that was part of the ACA. The getting rid of pre-existing condition exclusions, massively popular. People didn't realize it was part of the ACA. Getting rid of lifetime caps, massively popular. People didn't realize it was part of the ACA. Having a set of benefits that people can be assured they get when they're sick, very, very popular. People didn't realize it was part of the ACA. Now, not every part of the ACA was popular, but there was one thing in it that was very unpopular. But the vast majority of things that were popular, people didn't know were part of the ACA. And then, in fact, come to find out, people didn't even know the ACA and Obamacare were the same thing.
Okay. You know, Jimmy Kimmel did this sidewalk interview where he asked people if they supported the ACA or if they liked Obamacare better. And people would say, I didn't like Obama, I hated Obamacare, I really support the Affordable Care Act. That's just his comment, how confused that got. But it seems to me that America wants to move towards universal health care. So, do you see it that way? I certainly do. And the question is, what are the who are the biggest fighters against that, and what's the implication to the insurance companies?
Yeah, well, it's interesting because, and I believe it was Senator Cassidy, Republican senator from Louisiana, physician, who said pretty much what you just said. He said the fight over whether or not healthcare is a right or a privilege is over.
Mm-hmm.
It is a right. So there are conservative Republicans. I mean, I think a lot of Democrats probably have felt that way.
Mm-hmm.
More so, I'm not trying to typecast, but to hear now, the debate has shifted. The debate has now shifted closer to how we do it better, and closer to how fast, and to what type of model. Limitations of the people. There are people who can talk to blue in the face about it. They love free markets, and free markets are great. I can tell you 100 reasons why free markets have limitations. People can talk to the blue in the face. They love the government model. I could talk about the limitations there too. There's no, not necessarily one way to do it. But what you said, I think, is one of the most important things that I think a lot of people should take away or are taking away, which is the question of, are we developing something close to a national consensus that healthcare is a human right? And I'm not going to answer that question. You all may have a sense of that, but I think there's momentum in that direction. Consensus is obviously formed imperfectly in democracies, and over time. But if you look at the polling, if you look at the town halls, if you look at a lot of the input, there does seem to be a consensus in that direction.
Yep. I think it's the thing that the Republican administration is up against. That was kind of the hidden thing. You know, they thought it was some debate in Congress, and it's like, whoa, there was another wall called America.
Yeah, very good.
And I think it's I think we're in an amazing time. Hopefully, we move faster in that direction. There's no reason.
It's a good observation. I mean, I think all of our experience in this country is that we go fits and starts. We go forward, we go backwards, we go forward, we go backwards. But eventually, if you're optimistic, we get closer, yes.
Two things. First of all, thank you for coming here. I can't believe how much information you get out of, for example, Fulton's here. I mean, just dialogue and just talking and learning, and that'd be cool. So, I have a question for you, which might speak to Lisa question too, about, do you think that there's, in your opinion, do you think there's anything that can be done to rein in the, especially the for-profit insurance companies? It's kind of with that transparency, it's kind of with the cost, is it, you know, is that where we're also, is that where we're losing a lot, where the costs are going up? You know, what can be done on that aspect?
Got it. Questions about profit. So there was something in the ACA which I should talk about, and it's called the MLR. And actually, I think Senator Franken may have been the one that sponsored this piece of it, the medical loss ratio. And what it said was that insurance companies have to spend, depending on their size in the market, 80 or 85% of their premiums, your premiums that you pay them, on your medical care. So essentially forcing down that 30% to something more efficient. Now, I read an article today in a magazine where someone wrote that great way to dismantle the ACA is to get rid of the MLR. So someone actually, you know, people are looking, again, people feel like you can pull out one piece and the whole thing gets weaker, which is, I think, a lot of that construct. But that notion, that idea, which says essentially, if people are paying you premium, you've got to spend the vast majority of it on their care, is intended to do exactly what you said. Whether it's gotten all the way there, whether it's done enough, you know, that's a good topic for debate and so forth. But that's one of the mechanisms.
Hi. Okay. So since we're talking a lot about the interdependencies of the various parts of the ACA, I know from following your Twitter that you referred to eating your vegetables and having your dessert. We've talked about the dessert parts of the ACA that everybody loves. Can you make an argument for eating your vegetables or explain that a bit more?
Great question. Thank you. So the one part of the ACA that's polls is unpopular is the notion that people should comply with something called an individual mandate, which means that it essentially is intended to compel people who are younger and healthier and wouldn't be inclined to buy insurance to get into the pool. Because we all know that they're eventually going to get sick, and when they do, if they don't have insurance, they're going to cost us a lot of money, and it brings things down. Now, that makes a lot of sense to a lot of people. It was actually a Republican think tank idea by Heritage, but understand that it's not popular. And as I think what I said was, it's about as popular as vegetables are with my kids, which is to say, good for us, but understand people don't like it. And so the question is that the only way? Are there other ways? So two senators, Republican senators, Cassidy and Collins, have proposed a different way. And that different way is actually something called automatic enrollment, where people would be all automatically enrolled, and then they could disenroll if they chose to. So there wouldn't be a requirement, but you would end up getting more people in the pool that way. That could work. There are other things that could work. But I think the bigger point is, if we want to do away with the vegetables, we want to do away with vegetables entirely and say, nope, we're not going to have any mandate, we're not going to require the people pay into the system even when they don't think they need it, then the consequence is everyone's premiums are going to be higher by 20%. So we're willing to do that, and that 20% can be paid for either by tax dollars or it can be paid for by Americans, by you as consumers. One way or the other, though, we're paying for it. So we just have to recognize that there's consequences to every choice, and if we choose to go without our vegetables, because we kind of don't like our vegetables in this country sometime, then it's going to make healthcare a lot more expensive still.
What about the idea of just putting some raise the payroll tax? I mean, that's how Medicare, that's why they're doing good, they get money. I mean, everybody pays for that, and everybody gets that benefit. Seems like what we want to do is cover more people, but nobody wants to pay
is important.
Thanks again for this. As we're kind of facing a number of years of wholesale and incremental attacks on ACA and healthcare in general, there's been fantastic employment. Could you maybe give us something to be hopeful about as we're trying to improve these waters?
Yeah. Yes, I mean, look, I think that if our lawmakers hear, and as I believe many of them are hearing, that when people said they want to see repeal and replace or whatever, they expect the law to get better. They expect us to work on our problems. They don't expect us to make things worse. They're responding. Just today, a congresswoman from California became another hard no. The moderates in Congress, Eric is quickly becoming, now Eric I don't believe is a moderate necessarily, but he's in a moderate district. And he's becoming in the minority. He's becoming one of the fewer and fewer holdouts of folks who are voting with the speaker instead of with the district as that happens. So I believe, if you're optimistic, that people will eventually come around and hear what the people that voted for them think. And I believe that not just because I'm a wild-eyed optimist, I believe that because Congress has one great skill, and that's survival. And so I do believe that facts are getting out. I do believe that people are listening. I do believe that there is that progress has been made. And the other thing I'd say is, compared to 2009, we're in a much better place. And so we're having a debate about whether or not we go backwards from where we are today, but we're having a strong debate, and I think that's all healthy. You know, my perspective is, if I go back to what really is important here, you know, to me it all goes back to that notion of, do we as a country want to essentially rob our safety net to do a giant tax cut? And that's something that I think is going to be an ongoing discussion, an ongoing battle. I don't think anybody should be comfortable with that outcome. You all may have your own views on where you stand on that issue. I just want to be making clear that's what I think we're going to be fighting about, even if that's not what people are publicly talking about. And so we should be heard about that, and we should make sure that we're getting listened to. And I am optimistic that we're getting listened to. So I think that's why I'm hanging around on these issues.
So Andy, in the short term, it's April 18th, and this might hit the floor again in May. So that panics me. I mean, I love the talk about, you know, where we want to go in the future and what are the things we could do. But in a month, you know, things could change drastically for me. So I've met with Paulson one-on-one, gone down the whole thing and got a form letter about makeup. So what is it that I can do right now, or what is it that this room can do to have an effect on him in the next 4 weeks before this goes? I mean, right now, in the short term, do we write letters? Do we send emails? Do I keep going back to his office? I don't know what to do.
So my expertise is more on the policy side than it is on that side. I mean, I would tell you that Jenna and the group here, just by having this forum and the work that you all are doing is highly effective. It's getting noticed. And my sense this morning is that Eric is not missing it. Eric is getting those points. He's seeing it. I don't think he's not seeing it. Will his mind change? You know, that's up to him. And I think the more he knows what his district is thinking, the more likely it may be that his mind does change. But I would say, look, there are going to be several series to this in Congress. So it goes in May. Let's say it gets to the floor in May. It gets through the House. Then it goes to the Senate. My sense is the Senate would never take this bill up. The Senate Majority Leader has no interest in this bill. So we're gonna be all over again, probably starting from scratch with a new bill and a new process and a new set of dynamics and a new set of interests and a Senate that's much more focused on the issues of Medicaid and these sorts of things and the content of the bill. So I would say to you all, this is not gonna be straightforward. There may, if you are against this repeal, think like an underdog, because you are. I would tell you that the House and the Senate Majority Leader have lots of tools to get things passed, including saying, I won't do your tax thing until we do this, I won't do your infrastructure thing until we do that. Many things that have absolutely nothing to do with healthcare that can be used. So think of yourselves, if you care about this issue, as an underdog, fighting uphill, and I think that's your best chance. I think we have, how much more time, like one or two more questions?
You talked about why Medicare for all and Medicaid for all probably aren't practical, and another questioner asked about the federal employees. I'm surprised that the Republicans haven't proposed a single funded, taxpayer-funded plan based on the federal employees plan, which is sometimes held up as a model.
No, it's a good idea. And look, I will say this, behind the scenes, and I'm having conversations with a lot of the senators and congressmen on both sides, people are working on ideas. People are talking about things that are outside of what we're seeing and hearing. There's no forum for it right now. I mean, right now, we're still in a forum of repeal and torch. Until that leaves, all of the good ideas, and I think we have heard a lot of good ideas, aren't gonna make it anywhere. Because there's no climate to have a reasoned conversation when people are pointing a gun to your head. And that's just essentially what's going on right now. If that stops, if repeal comes off the table, you know, there have been people in the White House having bipartisan conversations on the side. There have been people in the Senate, and we've all been, I've been a part of a lot of the dialogue. It's there if the climate changes. The problem is right now, there's a few people, like the Speaker, who's very focused on this tax bill. And until that breaks, until that becomes impossible, I don't think that kind of dialogue is gonna happen. Let me take one more.
You talked about the implications on competitive bidding, CMS contracting in regards to both access and cost, and whether or not you see that as moving into a way to combat pharmaceutical prices, especially Medicare.
Competitive bidding for Medicare Advantage or for medical equipment?
Yep, either one.
Wow, that's a great question. Okay, so here's the question is, why, tell me if I'm capturing your question right, why don't we have more of an, if we're gonna have the private sector, why don't we make them more efficient by making them competitively bid so that we'll drive the cost down? And our estimate is that the federal government and Americans would save hundreds of billions of dollars if that happened. We did it in durable medical equipment, and I'll tell you that I have carried the scars from everybody that fought tooth and nail to say, no, if you do that, people aren't gonna have access to the durable medical equipment. Well, we set up a special team to make sure we had access, and we monitored it. We saved tens of billions of dollars on a pilot. We couldn't find one person in the country that didn't get access to what they needed, because that was our top priority. So there is a huge opportunity to move to something called competitive bidding. Why aren't we there? I think you could probably answer your own question, which is there are entrenched interests that make that very, very difficult. But for prescription drugs, for Medicare Advantage, in lots of places, I think that's right. And I was the customer on the taxpayer's behalf, so I fought pretty hard for those things, but recognize that an informed question like that, an informed public, will make that far more likely to happen. So I want to just stop here. You guys have been sitting for a long time. You've been incredibly patient. The notes has gotten very wonky. I would say, just close, say a couple things. One is I don't pretend to have all the answers. I tried best I could to tell you what I thought was factual and what I thought was my opinion. And so if you heard things you disagreed with, understand. But I wanted to just tell you what I thought. Secondly, I am committed to continuing to stay involved and to help here. And if you want to stay informed or at least know what I'm seeing or thinking, you can follow me on Twitter at @Slavitt, for those of you who don't. And what I try to do is wherever I go, whoever I meet with, if I go to Congress, if I go talk to a governor, I'll tweet about it so people can see the issues, and people tweet back at me in the best I can. I try to answer people's questions, but I try to keep people informed, because there's nothing worse in this climate than feeling like you're in the dark and powerless. Nothing worse. And so that's what I'll try to do. If you want to follow me, you can do that. And then finally, I'm hoping for a good outcome. I certainly was not here in any way to try to embarrass our congressman today. That's not him, actually. But I really do hope that he hears what's going on in the district, that he responds, that he comes and does these town halls. And I'm just frankly blown away, impressed with the great questions and the passion of all of you. So thank you very much.